Hi, my name is Gina Delia, and my presentation relating to anatomy and physiology of speech and language is on vocal nodules and how they can develop, as well as vocal cords and how they occur. To start off, what are vocal nodules and vocal cords? Vocal nodules are sometimes referred to as vocal cord nodules, develop as a result of using one's vocal cords or their voice in an excessive amount for a long duration of time. In order to understand where and why vocal nodules develop, it is imperative to understand the anatomy of vocal cords, also referred to as vocal folds. Vocal cords are located in the middle of one's larynx or their voice box. They are folds of muscle which are attached at their outer edges to the larynx wall by a muscle to be able to change their position for voicing. One's larynx sits on top of their trachea or their windpipe, a tube which allows for air to move in and out of their lungs. A region in the beginning of the larynx is called the glottis, which is further covered by the epiglottis, which can be remained closed on top of the glottis or open. When open, this allows for air to move freely in and out of the larynx. While focusing on speech production and the physiology of vocal cords, proper respiration includes inhaling air and exhaling air, aids in proper speech and voicing. During inspiration, when air is flowing into the lungs, the diaphragm is pulled downward. This further increases lung volume. The intercostal muscles between the ribs allows for the ribcage to be slightly pulled outward and upward, aiding in the maximum amount of air inhaled by the body to the lungs. During expiration, when air flows out of the lungs, the diaphragm is moved upward. The lung volume further decreases as a result. The intercostal muscles allow for the ribcage to be pulled slightly inwards and downward, aiding in air to be pushed out of the body from the lungs. When both of these processes occur and air is entering and leaving the lungs, the vocal cords remain open in order to allow air to freely pass through the larynx from the trachea. Picture 1 shows how vocal cords in the larynx look when air is passing through, remaining open for easy airflow. Voice and sound production occurs when vocal cords are now closed. During expiration, the vocal cords vibrate, causing sound production. Picture 2 shows how the vocal cords in the larynx look when sound production is made, remaining closed, cutting off airflow. Vocal cords, what vocal nodules develop on, have various functions, including their ability to open and close, which does not just aid in airflow, but also prevents food and water from entering the respiratory tract, helping to block objects from entering to ensure a clear passageway. They also can close during coughing to further block any mucus that's coming up or can enter. Along with the help from the epiglottis, which covers the glottis beginning of the larynx, from further blocking food and water that can possibly escape to enter the respiratory tract, ensuring a clear passageway for airflow as well. Briefly touched on previously was how vocal cords work to produce sound as a result of them being closed. When vocal cords are closed and they touch, they prevent airflow from coming up through the trachea from leaving. This closure places pressure on the vocal cords as they are attached to the walls of the larynx only from the outside, causing the middle of the vocal cords to vibrate. During vibration, a small amount of air escapes from the closing, which both of these factors together is what results in the production of sound. Speech production is further made by other structures located in or on the face, such as the mouth, teeth, proper tongue placement, even proper lip shape, and also control and respiratory processes, all aiding in proper speech. As this presentation is now focusing on vocal nodules, it is imperative to understand how the misuse of vocal cords could result in vocal nodules. For example, during sound production, which uses air expelled. As previously stated, when examining the anatomy of vocal cords, vocal nodules develop on the flaps of the vocal cords, which are towards the middle of the larynx. These develop in the middle region due to this being the area used heavily in sound production. Therefore, if vocal cords are overused, the muscle folds develop a callus-like growth, slightly swollen and benign, meaning non-cancerous. In the first picture shown on the slides, And in the first animated picture out of the three possible vocal cord lesions, one can see an example of how vocal nodules would look, as they are slightly swollen, callus-like growths located in the middle of the larynx on the vocal cords. Risk factors for developing vocal nodules include talking excessively and or loud forced talking. This puts strain on vocal cords, which due to the developing nodules no longer close properly when needing to make voice. Therefore, speech can come out hoarse, strained, and individuals can even lose their voice as a result of an excessive overuse of their voice. People at risk include teachers, especially those teaching to a younger audience, such as children in kindergarten, first grade, and second grade, as these children usually demonstrate non-obedient behaviors, needing the teachers to use a more forceful tone of talking, which puts an immense amount of strain on their vocal cords, putting them at a higher risk to develop vocal nodules. Other people at risk also include coaches, singers, and professional speakers, as well as children such as infants and toddlers, as they use their voice to cry and produce sounds, such as whinings. Another set of people at risk are those individuals who commonly attend concerts, which they can put a lot of strain on their voice due to an excessive amount of screaming, and forced talking. If an individual thinks they might have developed vocal nodules, they can allow them to go away on their own by resting their voice, due to vocal nodules not needing the immediate attention of a medical professional. However, if an individual is concerned, they can see a medical professional, such as an ENT or an ear, nose, and throat doctor. An ENT can perform a laryngoscopy, which, using an endoscope to perform the examination, shown in the second picture on the slide. In the two pictures at the bottom, one can see a relatively extremely thin and narrow tube. The medical professional can use an endoscope to perform the examination. As the thin and narrow tube enters the throat, it examines the outward appearance of the vocal cords to see if there is any growths. Other growths which can occur on vocal cords include polyps or cysts. Doctors can also use a device called a stroboscope, which measures how easily vocal cords vibrate to determine if there is any lesion, such as a nodule, polyp, or cyst. In order for an individual to prevent or slow down the development of vocal nodules, one can go to voice therapy. In voice therapy, one can work on their voicing and breathing, as exercises can increase one's ability to make their voice stronger, less prone to develop vocal nodules or any further vocal cord injuries such as further lesions. Overall, this is a summary of how vocal cords work. However, more specifically, vocal nodules and how they can develop as an overuse and misuse of speech production. Thank you.